Hello, I'm Rashad Bishara. I'm the Vice President of the Vascular Fellowship Training Program. Let me share my screen with you. I'm going to talk to you about challenges of revascularization in the diabetic foot patient with severe tibial artery disease. The intending learning objectives of this presentation are, first, and maybe most important, patient selection for tibial angioplasty. Second, how to obtain access for tibial interventions. Third, some tips about crossing techniques for tibial artery lesions. Also, some tips for retrograde access of the tibial arteries. And finally, how to face the challenge of renal impairment. I hope you enjoy this presentation. The first challenge is patient selection. Whom do we operate upon? I'll start with the reverse, when not to do tibial revascularization. When not to do tibial revascularization, it's on the asymptomatic ischemia patient. So typically, a patient comes to you, he has absent pedal pulses, or he has a low ankle brachial index or toe brachial index, or he comes to you with a long occlusion of the femoral artery or one of the arteries, but the patient is asymptomatic. This patient is not candidate for tibial interventions. And these are the guidelines. These are the guidelines of the European Society for Vascular Surgery, published in 2015. And they say clearly, we recommend against invasive treatment for peripheral arterial disease in the absence of symptoms, regardless of hemodynamic measures and regardless of imaging findings demonstrated peripheral arterial disease. Well, what are the indications for tibial artery revascularization then? Well, there are indications that we are all aware of. These are the critical lymphadentic ischemia, such as those examples. Obviously, severely ischemic feet with established gangrene of the toes or the heel or the forefoot. These are obviously patients with severe limb-threatening ischemia who are candidates for intervention. But what about this patient? A patient presenting with infective gangrene of the second toe. Is this foot ischemic or not? How ischemic is it? If we amputate the second toe only without revascularization, is the wound going to heal? We need some hemodynamic parameter to give us the answers. How to assess foot perfusion? Well, duplex ultrasound should be the initial investigation to assess foot perfusion in suspected peripheral ischemia. And again, these are the recommendations of the European Society for Cardiac Surgery and the European Society for Vascular Surgery. And it says clearly that duplex ultrasound is indicated as a first-line imaging modality to confirm the presence of peripheral arterial disease in suspected cases. And this is a class 1 recommendation. We have created our own parameter, which is derived from duplex, that is the ankle peak systolic velocity. And we have shown that an ankle peak systolic velocity of 35 centimeters per second or below, it's very unlikely for diabetic